Hey everyone, how you doing? My name's Gus, I'm a cosmetic dentist based near London in the UK, and today we're going to look at all the options you have to replace missing teeth. Now I'm not talking about replacing all of your missing teeth. Typically a lot of people have just a couple of teeth missing here and there or whole sections, and we're going to look at all of the different ways that you can do this, and then I'll show you how things like dental implants have completely changed how we can rebuild a mouth. So this is the second time I'm shooting this video. The first time I lost the footage. It's really early in the morning on a Wednesday. Grab yourself a cup of coffee and let's look at our options. So when I was in dental school, we were often given a couple of different options to explain to our patients. So there's 4 options. If a patient has a missing tooth, number 1 option is do nothing. Okay, this is important. It's not essential to have your teeth replaced. Sorry. The second option for those people who wanted to have a tooth replacement is something called a removable partial denture. A removable partial denture is essentially a plate, and it's the most common way of replacing missing teeth. In the UK, it's widely available on the NHS. In fact, it's the only tooth replacement which is available on the NHS. Now, these tend to get a bad name, typically because they're done done to be cheap. Now there are a massive variation on the quality of removable dentures that you can have, and if you don't mind having something removable, it's probably the most cost-effective way to get a good set of teeth. They can be made to look really nice using high quality components. They can also be very sturdy. Now when we're talking about sturdiness of dentures, there's 2 things. We're talking about retention, which is if you've got a top set of dentures and you just let go of it, how well does it retain? How well does it stay sitting where it is? Okay, obviously we don't want it to fall down. The second thing is stability, and stability is when you chew and eat, how does it move around? Because sometimes it could be that the denture sits really well and is quite firm up in the mouth, but as soon as you eat something, the biting forces just cause it to move sideways. Okay, so there's retention and stability. And in general, the more of your own teeth you have to lock this denture in with, the more retentive and the more stable the removable denture is going to be. Aesthetics wise, they can be made to look really nice. It all depends on the dentist you see. Obviously, if you see someone who is trying to do everything as cheaply for you as possible, then they're not going to spend as much time on the aesthetics, and which is fine, because a lot of people just want some teeth to eat with, which is absolutely fine. Now, let's say we don't want to have a removable denture and we want to have something a bit more fixed. Our next option is something called a dental bridge. Now, dental bridges, some people think they're quite old-fashioned, but in the right cases, we still do them. I mean, look at this case. Here, the guy had a whole bunch of missing teeth. He had teeth which are discolored, uneven, and he wanted to rejuvenate his smile. He was on a bit of a budget, and that meant that dental implants were out of the question. But by using porcelain bridges, we were able to rebuild this whole smile, no implants, no surgery. It's a lot quicker to do this treatment, and often it's a little bit cheaper as well. And with a bridge, you've basically got your false tooth attached to either 1 or 2 of the teeth either side, which in itself, this limits the number of people who can have this, because if you imagine you've got a whole section of teeth missing, where you've only got a tooth at the front to hold on to, you can't have the cantilever part of the bridge, i.e. the unsupported part, going towards the back of the mouth. The reason for this is the back of the mouth generates more forces, so if you've got that loose end of the bridge up towards the back, it's going to create a levering force on the tooth on the front, which is going to mean that either the tooth breaks or the bridge keeps coming out, which is just super annoying. There are multiple variations on the type of bridge. You can have bridges with very little preparation on the teeth. You can have bridges with more preparation on the teeth. This really depends on your own clinical situation. Which tooth is being replaced? How much load that tooth actually takes? Do you have a tooth below it? There's a number of things that a dentist would need to take into account to choose or advise you on what the better type of bridge is. So the third option to replace your missing tooth is a dental implant. Now, dental implants can be used in a lot of different ways. The simplest way is actually if you've just got a single missing tooth, you can have an implant placed which effectively replaces the root of the tooth, and then once that implant is integrated, you can then have the tooth placed on top of it. And there's three sections to it technically. There's the implant, there's the abutment, and then there's the crown. But in a lot of the cases which I do, the abutment and the crown are one unit, because that's a much simpler end result, and it means that we can, if there's ever a problem later on, all we need to do is unscrew the tooth and the whole thing comes down. We've got direct access to our implant. Now, dental implants can be used in a number of different ways. They can be used to modify dentures and bridges. So let's look at that, because let's say you don't mind having a removable set of teeth, but the biggest problem with it is, let's say you don't like the feeling of the roof of your mouth being covered, you don't like the fact that they move around, and you don't like the fact that when you're talking, there's a risk of them falling. So we're talking about retention and stability and bulk, actually, of a removable denture. Now, you could have either a standard implant or a mini implant placed, which has they're typically called locator connections, but there's multiple different connections, and this is essentially a little clip which can be fitted to the inside of your denture. So remember I said where removable dentures, the more teeth you have, the more stable it is. A dental implant can be specially manufactured in such a way that you don't need to rely on teeth. You can rely on your dental implant to give you that stability and the retention to replace your to hold your denture in. So that's exactly what we've done for this patient here. She's missing all of her lower teeth. Forgive the photos, they were taken on the day of surgery, but you can see we've got 4 mini implants here, and we've got these little black connections at the top. Here's a case which we did with standard implants, a very similar connection to these, and essentially what they do is create a very positive click when the denture is placed. This denture is not going to move around when the patient eats, it's not going to fall out when the patient talks or anything like that. In fact, there's a variety of tightnesses we can fit the denture to the implants with, and I've never had to use the most tight version of this. So now we're starting to think outside the box and think, okay, look, I don't mind having a denture. I want to get this done as cost effectively as possible. Mini implants with a removable denture is probably the most cost effective way. And also, I spoke about bulk with removable dentures, especially at the top of the mouth. The reason they have bulk is to cover the palate of your mouth, and this creates a suction so to stop them falling. But because we're not relying on the suction now to hold it in, we have these mini implants placed in, we can now make the whole denture out of metal, and maybe with the roof of your mouth exposed, which is more comfortable. It helps you taste and enjoy foods a lot more. Next, if we look at bridges, traditionally we said that we've got a tooth, then we've got a gap, then we've got another tooth, and then we have a bridge fitted on top of those. So let's say you've got a gap of 3 teeth. So traditionally you would have to have a bridge which is of 5 teeth, including the teeth either side. This is essentially putting the force of 5 teeth on 2 normal teeth, okay, on 2 roots. So the amount of force per tooth becomes more. Now, what we can do is place 2 implants and have what we call a 3-unit bridge connected into the implants. So therefore, we've actually got 1.5 tooth force going per implant, and we know implants can take a good amount of force as long as the bite is taken into account when it comes to actually putting the bridge on. So we've taken a bridge solution and taken it over to implants rather than being reliant on natural teeth. And when I mention this to some people, especially occasionally I'll get people who've got unlimited budget and they say, look, I just want 3 implants. Actually, sometimes it's better to have 2 implants, have them well spaced apart, and then have a bridge. Aesthetically, it looks almost identical. The only difference is you can't floss the contacts of a bridge. And if we take the bridge example to an extreme, when we're talking about our all-on-4 procedures where we're replacing a full set of teeth on dental implants, this is essentially what we're doing. We've got either 4, 5, 6 implants or however many is appropriate, and we have one bridge which may be 12 to 14 teeth on it, which is sitting on a much fewer number of implants. So essentially we're bridging that gap between all of the implants with the teeth to create that aesthetic look and to get the result that we're looking for. And it's in a case on all-on-4, we're not doing it to keep costs down, but we're doing it because we know that works and it's the most efficient way to do it. In fact, it would almost be impossible to replace one tooth per implant when you've got all of your teeth missing. So I hope you found this video useful. If you did, please give it a thumbs up. You can always comment down below. You can also find me on Instagram. Out of all of the social medias, I'm probably most active on Instagram, and you can find out what I'm doing day to day. There's before and after photos. To be honest, I post more on the story than I do on the feeds or anything like that. But I just find that those people who contact me via Instagram, they'll probably get a quicker response, just because replying on YouTube comments just requires different apps, and it's a little bit of a different system. Okay, so as always, I will try and see you next week, as long as I don't delete my video files by accident, and until then, take care guys.